weekend. We were scheduled to do a Facebook Live last Sunday, but we canceled it because of the Black Lives Matter protests and the unrest that was happening in many of our cities across the world. And I just want to start off, we have a number of practical questions about this topic, but I do want to start off by saying that I think a lot of us who study the pandemic and also social root causes of health disparities, such as systemic racism, are really torn right now because I think we are going to see cases cropping up as a result of the mass protests, and at the same time that we support the protesters and the reasons for those protests and the need for systemic change. And so, you know, as we address these topics of risk harm reduction at the protests, I just want to keep in mind that we do have this tension where we're seeing where, you know, we have both. We support the protesters and we're concerned about disease transmission at the protests. So Amanda, I know you want to talk about this topic in particular, so I'll throw this one to you. I have a number of questions about how to do harm reduction at the protest and what to do after having been to the protest. So you want to tackle a few of those questions?
Sure, thanks. And I'll just build off of what Malia said, in that we recognize this false dichotomy really in asking people to either stay home, not protest and protect themselves from COVID, or go out and protest, because the reality is for many communities that are protesting, even if they stay home, because of those same upstream social structural factors and systemic racism, they will still be at greater risk for COVID. And so that it really is a false dichotomy, and we do support this broader effort to address some of these structural factors that inevitably are the determinants of a range of health outcomes. And so thank you to those, you know, communities that are engaging in this really important work right now. And there are ways that we can engage in protesting and sort of reduce some of the risk involved. You know, we have been posting this week on this topic, and Malia and I have, you know, been giving interviews on this topic this week. And one thing off the bat that we want to emphasize is that there's a role for individuals in this setting, and there's also a role for law enforcement. And so we're going to address both of those issues. For the individuals going out and protesting, you know, some benefit to being outdoors, but we still want to try to maintain social distancing when you can. You know, if you go out in groups of people that you already are in contact with in your household, and you can mainly stay with those groups, that's better than mixing into a crowd. We know that that's not always possible. Wearing a face mask is definitely a must in these scenarios. You know, while a lot of protesting involves shouting and call and response, and we recognize that when there's opportunities to do other things like make noise with noisemakers, or, you know, amplify voices with megaphones instead of shouting, those are ways to reduce risk as well. And then there's other kind of just general guidelines that, you know, bring water, wear sunscreen, and bring, you know, food and snacks and other ways to sort of be prepared to be out on the street for a long time. And I think probably my colleagues here have some other tips that they can add on in terms of, from the law enforcement perspective, we think there needs to be a partnership with protesters to try to work towards infection control. And so that means not corralling people into tight spaces. That means not using respiratory irritants like tear gas and pepper spray, which actually, those types of things we think are adverse to health in a number of ways, not just in the context of COVID, but certainly making people cough and sort of exacerbating the droplet transmission is not ideal. And so we have a call and an expectation to law enforcement to partner with protesters towards infection control in these scenarios. And then if you've been protesting, you really could think about in the next week, definitely monitoring your symptoms, number one, potentially seeking out a test. So it takes about an average of 5 days for symptoms to emerge, but it can take up to 2 weeks. We hope that communities will rally around protesters and provide free testing and support to individuals so that we can identify anybody who might have acquired COVID at these events. And then you might think about isolating yourself from anybody in your family who is vulnerable to adverse complications of COVID. So, if you're out protesting, maybe wait a week or 2 weeks to go visit your grandma or anyone else that you think is vulnerable. And I'll sort of turn it over to my other colleagues who I think probably have some additional ideas.
Yeah, any further thoughts on those?
Yeah, that was really helpful, Amanda. I had family members out in Philadelphia yesterday, and I really appreciate the reminder that we should get them tested in the coming week, especially as the summer with getting together with grandparents and other households. We need to kind of reset our clock in quarantining again before we think about